Thank you. Thank you, everyone, for being here. And thank you, Theo, for the very kind introduction. And I have to, in turn, get back to Theo and say thank you for giving me the opportunity and allowing me basically to take this leap and get into a field that I was I wasn't so much familiar with, but I learned so much throughout the past 3 years, and it was a lot because of your support and your help. I also want to thank my fellow fellows here because they actually really helped me, give me very valuable feedback when I was putting together this presentation. So today the title of my talk is Sexual Violence and HIV Risk Among Black South African MSM, Implications for Health and Prevention. Speaking of Theo, so the studies that I'm going to talk to you about was part of a larger project, an R01 funded by NIMH, awarded to Theo that was titled HIV and Sexual Risk in African MSM in South African Townships. And it was aimed at examining the lives of Black MSM in 4 townships of the Suwane municipality. And it commenced in December of 2008, ended in December of 2013. It included 2 phases, an ethnographic phase that included ethnographies, observations, and also qualitative interviews. And then the survey phase and HIV testing phase that included surveys collected from 480 men, which I'll get to. What I also wanted to mention was that I joined the project around July of 2011, and I had a specific interest in looking at sexual violence, so Theo allowed me to join the research team in that aspect, to look at sexual violence experiences of men who have sex with men in these townships. So this is just an outline of what I'm going to talk to you about today. So I'm going to begin by giving you an overview of the literature, current existing literature on sexual violence in male same-sex relationships. Then I'll move on to talk to you a little bit about what is the relationship that so far has been found between experiences of sexual violence and HIV risk behaviors, and why this is important, particularly in the context of South Africa. Then I'm going to get into those 2 studies. The first one is a qualitative study that contextualizes the experiences of men who have sex with men, their sexual violence experiences, and the kind of individual level, interpersonal level, and social and structural level factors that may be affecting the experiences of sexual violence and how in turn they may impact their health and well-being, and also sexual health. And the study 2 actually follows the same questions, but using a different method, using a quantitative statistical method to look at the same variables. So as you might already be aware, most of the literature on sexual violence or intimate partner violence has focused on men's violence against their female partners and in the context of intimate relationships. There's very little that we know about men's experiences, as if I try not to use the word victim, but let's say as victims of violence or sexual violence. And especially we know very little about experiences of sexual coercion and rape of men or rape of men by men. So because there have been such limited amount of studies in this area, also the prevalence that have been reported of how often sexual violence happens in these relationships is varied. So what we know about the prevalence ranges by a lot, as you will see in the next slide. Some of this is because of the way sexual violence was defined and measured. So whether it was asked, whether they asked men about their sexual violence experiences in the context of intimate relationships, or was it, has anyone ever forced you to have sex? And also, their sampling methods. Most of these studies have been cross-sectional. So this is just an overview of some of the studies that have looked at men's experiences with forced sex or sexual violence. As you see, the the prevalence ranges somewhere from like 9.6 all the way to 29%, depending on where the population was from and the methods in which the data was collected. Most of them are cross-sectional studies, and we know very little about what is the long-term impact of experiencing sexual violence. From what we so far know, sexual violence is shown to be associated with symptoms of depression, anxiety, and also it has been associated with alcohol use, drug use, attempted suicide, and even STI and HIV infection. I say associated again, because these are cross-sectional studies and we can't really infer causality here. We just know that there is a relationship that exists. We also know that men who have had any kind of unwanted sexual experiences, whether it was inside or outside of their intimate relationships, are also more likely to engage in sexual risk behaviors. So what we do know is that, first of all, there is a relationship between experiences of sexual violence and either being infected with HIV or being at risk for getting infected with HIV, engaging in high-risk behaviors. But what we really don't know is that why. Why is there a relationship in that? Well, there are only a very, very small proportion of HIV infections that are direct result of rape. A lot of the others are psychosocial variables that may be underlying this relationship. So the next two studies that I'm going to talk about was basically investigating in what is going on in this box, in this question mark here. So why is this important in South Africa? Again, it might not be news to those of you who are sitting here, but South Africa continues to have the highest prevalence of HIV infection. The prevalence, especially among those who are between the ages of 15 and 49, is estimated to be about 18%. And as you know, again, MSM remain to be one of the most at-risk populations for HIV infection. But again, this is the population that, even though at risk for HIV infection, are understudied. There is still so much that we need to learn about their relationships, about the sexual risk behaviors. And the studies that have so far looked at the prevalence of HIV among men who have sex with men in South Africa have documented the prevalence to be somewhere between 10% or 47%, depending on where they collected the data in South Africa, what kind of methods they used. I will get to this study. This is the second quantitative study that I'm going to talk to you about. But what we found from this R01 in South Africa, that the observed prevalence of HIV in our sample was about 36%. Sorry, I didn't. So aside from HIV, violence in general and sexual violence in particular are highly prevalent in South Africa. And violence and injuries are the second leading causes of death after HIV/AIDS in South Africa. And this is especially significant for men because men are disproportionately represented not only as perpetrators, but also as victims of sexual violence in South Africa. So as you can see, men who have sex with men are in fact at the intersection of two leading causes of death, experiences of sexual violence or violence in general, and HIV infection. So it is important for us to understand the context in which sexual violence is experienced by men who have sex with men in South Africa. But it's also important to understand what are those kind of risk structures, risk environments, or those psychosocial variables that may be connecting experiences of sexual violence to being at risk for HIV infection. And this is what I'll be addressing in the next two studies. So the first study, which was a qualitative study, of sexual violence. The goal of this particular study was to gain a better understanding of some of the individual level factors, such as sexual identity and gender presentation, some of the interpersonal context, such as who were the perpetrator, what was the relationship between the perpetrator, and some of the structural factors, the existing social stigma and discrimination, and to see whether any of what were the experiences of men in these contexts or related to these factors. But I also investigated and was interested to see whether these narratives, these interviews highlight any of the mental and sexual health consequences of experiencing violence. So participants were 81 men who reside in the Suwannee municipality township communities. The eligibility criteria for participation in the study was that they had to be black, between 20 to 44 years old, and the mean age of our participants was about 26. And they should have had sex with at least one man in the past 12 months. I also want to point that out that first of all, this was a semi-structured in-depth interview, but it was a very comprehensive interview. So it looked at many things way beyond just experiences of sexual violence. The common themes that were questioned were, for example, men's experiences with their family and community acceptance, their experiences of safety in their community spaces, experiences with discrimination and violence, their sexual practices and relationship, and finally then their negative sexual experiences, which was the area I was interested in investigating more. So I also right now want to point to one limitation of this study, is that this study wasn't designed specifically and originally to study sexual violence. It had a broader goal. So sometimes, depending on who the interviewer was or who the interviewee was, whether they were willing to share their experiences or not, we know very little or we know very a lot about some of those experiences. So some of the data may not be, I may not have the same data across all participants, basically. So we did a concept-driven, we had certain concept-driven codes that were basically based on the goals of the study, the aims of the study. And after we did the preliminary coding of the data by 2 coders, which then 3 coders, and then they reconciled the codes in dyads, we went back in, myself and Kate Collier, and we looked at specifically sexual violence and those passages that contain any descriptions of men's personal experiences of sexual violence, being pressured to have sex against their will, whether men had any experience of being threatened with rape or violence, or being raped or attempted rape by, or experienced rape or attempted rape by strangers. We coded these as sexual violence. So if any passage included any of these, they were coded as sexual violence, and 2 coders looked at that and reconciled that. So we found out that out of those 81 interviews that we conducted, 17 men reported some form or experiences of sexual violence that may have ranged anywhere from, an intimate partner making you feel guilty and that way forcing you to have sex even though you're not interested, all the way to being raped by a group of strangers. So that's why when I use the, let's say, phrase here, sexual violence, have in mind that specifically in this study, it's a wide range of behaviors, and it gets a little bit more specific when I get to the quantitative data. So I'll begin the results by talking about some of those individual level factors that may have had an effect or influenced experiences of sexual violence. So what we found was that all of our 17 participants who have experienced sexual violence identified with the label gay. So they self-identified as gay. And as some of you may know, in South Africa, not every man who has sex with men necessarily take on the label gay. So as you see in the other 64 participants who did not mention, which doesn't mean they didn't experience, but at least they did not mention experiencing forced sex, we see that only 41 of them, or 64% of them, identify with the label gay or self-identify with gay. we found that there were only about 5 participants who take on the identity of a transgender or labeled themselves as transgender, and we found that 4 of them said that they have experienced actually sexual violence, and only 1 didn't, again, which doesn't mean that she has not experienced sexual violence, but at least did not report it. We also found that most of our participants had self-reported having a more feminine gender presentation compared to only 39% of those who did not experience sexual violence. And what I mean by feminine gender presentation is that most of our participants, I don't want to say most, about half, but don't quote me on the number, but about half of our participants said they are both masculine and feminine. So what I mean here by feminine are those who specifically mentioned that they feel like a woman, they feel like a girl, they want to be treated like a woman, and they said their gender presentation is more feminine. So about most of the sample in those who have experienced sexual violence, and about 39% of those who did not experience violence had a feminine gender presentation. We also found that most of our participants had preferred a receptive sexual role. They considered themselves bottom compared to about half of those who did not experience sexual violence. And finally, and most importantly, there were 10 participants who reported that they are self-reported that they are HIV positive, 6 of whom were among those who have experienced sexual violence, and only 4 among those who have not experienced sexual violence. So again, even though it's not quantitative data, you can see that the profile of men basically who have experienced sexual violence is different than the ones who have not. They are more gender non-conforming. They are more likely to say that they have a receptive sexual role preference, and they're more likely to be HIV positive. So we organized the remainder of the results based on the relationship to the perpetrator. We found that some of our participants experienced sexual violence in the context of intimate relationships. From previous research, we know that sexual violence in the context of intimate relationships is often recurrent with experiences of physical violence and also psychological violence. And sometimes the perpetrator uses some psychological manipulation tactics, such as threatening infidelity or exerting control, or basically threatening that he or she, I guess, in heterosexual relationships, will be leaving their relationship if the partner refuses to have sex. And we saw one example of that in one of the quotations. So the boyfriend, wanted us to have sex, and then I refused. He was like trying to blackmail me that I'll probably have sex with other people. So I ended up having sex with him just to please him, not to feel anything. So as you see, the perpetrator was forcing the participant to have sex by making him or blackmailing him, to use the same word as he did, that if you're not having sex with me, so you're probably having sex with someone else. So, and that way forcing him to have sex. Again, what we know from also from the heterosexual literature, is that sexual violence sometimes occurs in the context of condom negotiations. So whether one partner is requesting using condom or requesting them to stop using condoms. As you will see in this particular example, the boyfriend of the participant wanted them to stop using condom, and when he refused, he got upset and he forced him to have sex. So the first time the negative sexual experience happened was on my birthday. The boyfriend, wanted us to stop using condoms. I was against it, and I think he forced a bit himself on me, and it hurt. And when he came back from his trip, he did it again. He forced me. Also, we know from previous literature that lack of sexual power and control is also linked to experiences of intimate partner violence. I was at first a little skeptical about this, because when I was reading these interviews, I had a feeling that a lot of men, when asked in general if they feel like they have sexual power or sexual control in their relationships, they said yes to that. But I found one particular interview which highlighted that, yes, they may have in general sexual power and control in their relationships. When it comes to an abusive partner, when they are in a relationship with an abusive partner, they feel like they do not have that kind of a power to negotiate. So the interviewer asks, in general, do you feel that you have control over what happens when you have sex with another man, or does the other man generally have more power? He answered, me in charge. So they don't have much power even though they're active or they're top. No. But were there instances where they were in charge? The participant responds, the one that abused me, he was in charge, but not right now. And actually this participant, I think I have another quotation by him, but if not, this is another participant who talks about the same partner or boyfriend being abusive or sexually violent as well. Actually, this participant also, and by the way, these are pseudonyms. So, but this participant have also experienced gang rape, unfortunately. So, most of the reported experiences of sexual violence happen in the context of a casual encounter, or the person just met and consented in having sex with. So most of the time in this context, sexual violence happened unexpectedly, and it was after the initial trust was built. I also have a couple of subcontexts here to explain. One is the subcontext of alcohol consumption, because many of these experiences happen while alcohol was being consumed, or in a place where alcohol was being consumed, and also in the context of transactional sex, which I will get to in a minute. So we know that actually excessive alcohol use is one of the risk factors for violence in South Africa. And in our also interviews, we found that participants explicitly identified those kind of experiences of sexual violence occurring in that context of alcohol use, or in bar and in shebeens. So, for example, a lot of our participants mentioned that the perpetrator was drunk, but we also had a few participants who mentioned that they felt like their own alcohol consumption made them vulnerable to victimization. As this participant describes, we were in a club and my friends left with their one-night stands. So I was left alone and this guy started pulling me to go with him. I tried to fight back, but because I was also drunk, I could not fight back enough. Because I refused, I did not want to have sex with him. He started being violent. I was bruised, even my mouth. So as you see, you hear a little bit of a self-blame going on here, and you will see that in another quotation that I'm going to show you in a few slides, that we know is actually one of the consequences of experiencing sexual violence, and also one of the symptoms of depression. So what we also found out is that sometimes transactional sex happens in the context of the bars and shebeens, in which men who have sex with men attend. And this is actually, I'm not going to get much into it. One of our former fellows, Sitsi, is actually working particularly on this, on a paper on transactional sex within this sample. What we found out is that sometimes in these bars and shebeens, sexual interest is signaled by buying a drink for someone, and accepting that drink or rejecting that drink signals the reciprocating, whether you're interested or you're not interested in having sex with that person. And sometimes they end up in violence. So for example, if a person buys another person a drink and they drink it, but then refuse to go back home with them, sometimes it ends up in violence. And not only that, as this participant here acknowledges, men who give you money or they buy you drinks, they not only want to demand sex, but sometimes in the context of transactional sex, it happens without a condom. That's what they request, basically. So we also had some incidences of rape, or at least the participant used the phrase rape. They discussed being raped in two different instances. Two instances were attempted rapes, and one instance particularly occurred in the context of an anti-gay attack, in the context of a discrimination among same-sex sexuality. Fortunately, two of the participants were able to fight back. But what this quote shows is not only that the person was able to fight back, but also that it ends by saying, what if I'm going to get AIDS? So it shows that men have this awareness that first of all, if rape occurs, it is normally without a condom, and also there is a high risk of HIV infection. So participants also reported on some barriers on reporting sexual violence to authorities because of the existing social discrimination and stigma in that environment. So this was reported by two participants, and we believe that because of this extreme discrimination, a lot of these incidences of sexual violence or rape go underreported. So as this participant mentions, I went to the front desk and reported that I was raped, and the guy reacted by laughing and said, how I was raped. And actually a lot of gay people, like my friends, have been raped, but they are scared of the humiliation, which made them not to go report the cases to the police. And this was actually, I don't have the quotation, this was exactly explained also by another participant saying the same thing, that it not only happened to them, it also have happened to their friends, and this is what keeps or prevents men to report experiences of rape to the law enforcement, and maybe even seeking care and going to a hospital and seeking treatment. So some of the narratives also pointed out to the mental health consequences of experiencing sexual violence. As we know, again, from previous literature, men or women who experience sexual violence have depressive symptoms. They experience negative emotions, regardless of what their relationship was to the perpetrator. And this could include fear and anxiety. And sometimes, as it shows in this particular example, it lasts a long time after the participant even experiences it. I didn't know what to do then. I thought it is going to be much better if I go to the police and report, but I was scared. I thought, like, what was I doing at the time? Was I drunk? I was scared in the streets and pubs. Even after I healed, I was always home. It is something that kept haunting me. Even today, it still does. So a few things that it shows is, again, the reluctance to go to the police. It shows feelings of self-blame, and it shows the fact that the participant still is having fear and anxiety long time after the incidents occurred. So self-blame is another depressive symptom that victims of sexual violence or rape go through. We had a few examples of that. This is another example because the participant ran into the perpetrator again. So the interviewer was asking whether you were angry at him. And he said, no, I was not angry. At some point, I blamed myself because I was the one who made the first move. So, as I mentioned in the first slide of the results, 6 out of these 17 participants also reported being HIV positive. So as I mentioned, sometimes it is the fact that actually getting infected with an STI or HIV is a direct result of rape. And we see that in 2 of the examples here. So this particular person said, the other time I had sex with the gunpoint guy, because this happened actually twice. After having sex with him, after a couple of days, I got a bit sick and my urine had a yellowish discharge. So I found out that the guy infected me with an STI. And the other person who was talking about being HIV positive, he said, I am positive. I think it's because I was raped 5 years back by 7 people. So as you saw, the results of the study reflected some of the individual level factors, such as men's gender presentation, sexual identity, and also some of the interpersonal level factors and social level factors that affect men's experiences of sexual violence. And you saw that the experiences varied a lot in terms of who the perpetrator was, the context of it, and what kind of violence it was. We also saw that our participants experienced fear, anxiety, and self-blame, all symptoms of depression. Just to get back to the point of HIV being related to sexual violence, again, we saw that there is a relationship, but what we wanted to know was basically how is this happening. We had three hypotheses for that. One was the gender hypothesis, that more gender non-conforming men are at high risk or are vulnerable both to HIV infection and to experiencing sexual violence. But also because those men, as they themselves report, prefer a receptive sexual role, they are just in general at higher risk for HIV infection. So it could be that those feminine men who have a more receptive role sexual preference are basically they are at risk for both HIV infection and sexual violence. The second hypothesis was the fear of sexual violence, especially if the violence is recurrent. And we know that, again, in different populations, that when experiences of violence are recurrent, those who are experiencing, the victims, feel like they don't have the power to negotiate condom use or ask for condom use. So they end up having unprotected sex oftentimes. Another hypothesis we had was that there may be some other psychosocial variables that we did not have data from in the qualitative research, such as, for example, childhood sexual abuse, which we know is directly related both to experiencing sexual violence as an adult, but also related to HIV infection, or alcohol use, again, related to both. HIV-risk behaviors and to sexual violence. So what I did in the second study, I followed the same questions in the quantitative data set to see whether statistically I can find evidence for these relationships that come from this third hypothesis and from what we know from previous literature. So the quantitative study used the same sample, and what I mean by that, the men who participated in the qualitative data did not participate in the quantitative part, but they were also residents of the same community. It investigated individual, interpersonal, and social and structural factors that were associated with experiencing forced sex. And I also statistically look at some of those psychosocial variables that may be underlying the relationship between experiencing sexual violence and HIV risk, and to see whether those variables can explain this relationship. So our participants were 480. They were recruited through a responder-driven sampling between August 2011 and 2013. The eligibility criteria was that they had to be biologically male between 18 to 44. Minimum age was, the mean age was 24 in this sample, and they have had to have sex with one man in the past 12 months. And they were also must be willing to receive an HIV test. The procedures were started with a computer-assisted interviewer-administrated survey. Again, it was a comprehensive survey. It took about 90 minutes to complete. It included themes such as intimate relationships with male and female partners, sexual behaviors, alcohol and substance use, experiences with discrimination and violence, and also questions on mental health. And then there was an HIV test that followed the survey. The participants were given an option either to do a VCT, a voluntary testing and counseling, in which they would receive their results, or they could choose to do anonymous testing and basically do not receive their results. But either way, all participants were tested for HIV. So to measure sexual violence, I use this particular question that asks, after the age of 16, has a man ever forced you to have sex when you did not want to yourself? This man could have been a stranger, someone you knew, or a regular partner. So what we were interested in was any experiences of forced sex. So you will see from this point on, I might refer to sexual violence as forced sex, because in this particular study, it was very specific what we were asking. So you will see me sometimes interchangeably, I use sexual violence or forced sex. This is just some of the demographics, just to give you an idea of what the sample was like. So about half of our sample had a high school education, but about 60% of them were unemployed. About most of them were not married. Only 3 people were married. 2 of them to a man and two to a woman, and one participant was married to a man. And as you see, again, there are still about 8% of the sample who do not have piped water. About 26% of the sample who do not have an indoor toilet, and it's still about 16 participants who say they do not have electricity where they live. Okay, our results showed that 62 participants, or 13% of the sample, reported to have ever experienced forced sex by a man. Basically, they said yes to that question. The relationship to the perpetrator was mostly someone they knew. 62% of the sample said they knew who the perpetrator was. 30% was by a stranger, and about 8%, 5 people said they have experienced forced sex both by a stranger and by a known person. So this is some of the individual level factors. As you will see, some of these we already had, such as femininity and gay identity, in the qualitative data, and we found support for it in the quantitative data. But I also looked at childhood sexual abuse, as we know from previous literature, is associated with experiencing sexual violence. So what I found was that all of these variables are significantly associated with ever experienced forced sex. So men who have more of a feminine gender presentation, men who self-label themselves as gay, those who have experienced childhood sexual abuse, and those who are HIV positive are also more likely to say that they have experienced forced sex. And more importantly here is men who are HIV positive are actually 7 times more likely to have said yes to experiencing to have experienced forced sex or sexual violence. I also looked at some interpersonal level factors that might have affected sexual violence, experiences of sexual violence. I found out that men who report having higher number of lifetime male partners, if they report they've had any unprotected sex last year, if they ever engaged in transactional sex, or if they ever engaged in group sex, were more likely to also say that they have experienced forced sex. And all of these relationships were statistically significant. We also found that men who have higher rates of alcohol use and higher rates of drug use, both of these are continuous variables, are more likely, again, to say that they have experienced forced sex. So again, kind of providing evidence for what we found also in the qualitative research. So finally, just to do it, I put all of the variables into one model, just to see whether some of this variance gets washed out, because some of these are, some of them are correlated with each other. And what I found was that even after controlling for all of those variables, when you put them all in one multivariate model, still childhood sexual abuse, HIV status, having had unprotected sex, and ever group sex were still associated with experiencing sexual violence. So they still strongly basically stay in the model. So if you remember, I said at the beginning, again, previous research has shown that, and we also found that whether in qualitative research or based on quantitative data, forced sex is related to being HIV positive. But what we don't know is that what are some of those, I use the word mediating variables, but some of those underlying variables that may be explaining this relationship. Some of them we know about from previous research, some we found in this particular study. So such as the ones mentioned here. And in order for me to establish such a relationship or to basically provide evidence that these may be the underlying variables that explain this relationship, first, I have to find whether they are related to forced sex, which we already know. I just showed you that all of these variables are related to forced sex. But I also need to show whether they are related to HIV status or not. In this sample, I found that group sex, having ever engaged in group sex, using drugs, and also experiencing childhood sexual abuse in this sample are not related to being HIV positive, which was actually surprising in the case of childhood sexual abuse, because we know from previous literature those who have experienced childhood sexual abuse are more likely to be HIV positive, but we did not find it here. So basically what I could look at as far as underlying variables that explain this relationship, I could only look at femininity, gay identity, have a number of male partners, unprotected anal sex, and transactional sex and alcohol use. So what I did was I conducted 6 different mediation analyses, 6 separate mediation analyses. I'm not going to go through each one of them, but I'd like to mention that all of the variables, femininity, gay identity, number of male partners, unprotected anal sex, transactional sex, and alcohol use, significantly mediate or reduce this relationship. What I mean by that is that men who are highly feminine, they are more likely to have experienced forced sex. Men who are highly feminine are also more likely to be HIV positive. And when I statistically control for femininity, this relationship decreases, and this amount of decrease is significant. So again, we can call it mediator, we can call it an underlying variable, but it's explaining something here, and I believe it's important. So now, just to get back to some of the mental health outcomes, we also found that men who have experienced forced sex also report to have higher scores on depression. They have lower scores on happiness, lower scores on self-confidence, lower scores on self-esteem, and all of these differences are statistically significant. We did not find a significant finding for hopelessness. Just to summarize, so 13% of our participants in this sample of 480 men reported to have ever experienced forced sex after the age of 16. Told me not to, Jimmy. But participants who had such experiences were also more likely to be HIV positive. We found out that these variables were associated with higher likelihood of experiencing forced sex, having a more feminine gender presentation, self-identifying as gay, having experienced childhood sexual abuse, having higher number of sexual partners, having unprotected anal sex in the last year, transactional and group sex ever, and using substances to be associated with forced sex. We also conducted mediation analysis that I just went through. I'm not going to report that. And we finally found out that men who have experienced forced sex were more likely to be depressed and less likely to be happy, self-confident, or have higher self-esteem. So again, previous research has shown or established a relationship between experiences of sexual violence and being HIV positive. But I believe this is the first study, first of all, I don't want to say the first study that documented that in South Africa among MSM, but at least the first study that looked at and suggested some of the pathways in which we can explain this relationship. And as you can see, this relationship, even though we just scratched the surface of it, is a very complex relationship. But I believe that this complexity actually offers us a new framework for designing HIV prevention interventions, maybe targeting, men who are highly feminine differently, or men who have experienced childhood sexual abuse differently, and take that into account when we're designing our interventions. And in that way, reducing not only rates of HIV infection, but hopefully reducing experiences of sexual violence and rape. So I also believe that the results of this research is important for raising awareness. As we saw, there is still this existing social discrimination, but also this institutional homophobia that is preventing men from reporting their experiences with violence and rape that need to be addressed. And I believe that, you know, this is just a start, and I hope that it gets continued. So I finally just wanted to mention that this research was funded by the R01 that I just went through, and I was funded by the NIMH training grant, the T32. And finally, I just want to thank our research team, especially Theo, and well, this couldn't have been possible with the large group of people that helped us in South Africa, but also to mention people I closely work with. Thank Curtis, who is here, and Kate Collier, who's not here, who has been very supportive in both studies, helping me out. That's it. Thank you.